name is Jason Emer, and I'm a liposuction and body contouring specialist from Beverly Hills, California. I use Realself all the time, and so we're here in Las Vegas talking about questions that I get on Realself and some of the 3 most popular questions I get, and what you're wondering is for the answers, so I'm going to answer them for you. My first question that I get is, what is fat transfer? And fat transfer is when you remove some of the fat from your body and inject it into other areas to give volume, to give rejuvenation, to help the skin complexion and tone. There's stem cells in the fat transfer, so wherever you inject it, you're going to get improvement. What's key about fat transfer is the way in which it's extracted. It has to be extracted gently. I use particularly a device called Body Jet, which is a water-assisted removal device, because I've tried all the other devices: ultrasound, hand removal, centrifuging or spinning the fat, and causing it to release the fluid that's in it to make it pure. But all of those methods make it so that the fat can get damaged. You want the fat to be as viable and having less blood, less connective tissue, having no impurities in it. So I use a water-assisted device, and I add something called PRP to it, which is growth factors from your own blood that help the fat last longer. And so having the right extraction using the right device will allow you to take pure fat, which has no impurities, no connective tissue or blood, and being able to inject it into other areas of the body to get either volume. So for the face, if you're losing some volume with age, in the cheek area, in the lips, in the temple area, you want rejuvenation, fat can be injected there. If you're looking for something different, like a high definition muscular development type procedure that I do for a lot of both females and males, you can take the fat and inject it into the breast to make asymmetrical breasts improve, into the buttock. You can get lift and contour. You can take the fat and inject it into muscle of the chest, shoulders, biceps, and calves in males to get muscular definition and size. There's stem cells that are in the fat, and so when it's injected, even if some of the fat doesn't fully last because it is a graft where only some of it will be maintained after it's injected, you're going to get improvement in the muscle. And I see people years later with that same improvement in volume, with the same improvement in contour, just because the fat was injected and it has stem cells. And so fat transfer really is going to somebody that knows about body shaping, reproportioning the fat, and being able to do the most gentle extraction and to take that fat and inject it to other areas to make it look natural. You don't want to take the fat and over-accentuate, make people look asymmetrical. You only want to enhance, and you can do that almost permanently with fat transfer.